Walking stands out as one of the simplest yet most powerful forms of exercise available, especially once you cross the 50-year mark. Physicians routinely recommend it for strengthening the heart, sharpening the mind, managing blood sugar levels, and extending overall lifespan. Yet there is one truth that almost nobody talks about. The way you walk carries just as much weight as whether you walk at all. Countless individuals unknowingly repeat the same walking errors day after day, habits that quietly chip away at the very benefits they are working so hard to gain. Some of these errors even introduce fresh problems, targeting joints, posture, and circulation in ways that are easy to miss. Today we are going to look at 7 of those critical mistakes, explain what makes each one harmful, and outline practical corrections that transform an ordinary stroll into a genuine health-building habit. And make sure you stay until the end, because mistake number 7 is the one doctors mention most often when speaking with people who walk regularly. Before we talk about the mistakes, it is important to understand why walking becomes even more valuable as we grow older. After the age of 50, several changes naturally begin unfolding inside the body. Lean muscle mass starts its gradual retreat. Stiffness settles into joints more readily. The metabolism shifts into a slower gear. Blood circulation, once effortless, can grow sluggish over time. These shifts are a normal part of aging, but they are not unstoppable. Regular physical movement, particularly walking, slows their progression considerably. What makes walking uniquely effective is that it engages multiple body systems at the same time. The heart beats with greater efficiency. Muscles stay primed and functional. Joints travel through their full natural range of motion. Blood flow to the brain increases, supporting sharper memory and clearer thinking. A growing body of scientific evidence confirms that consistent walkers carry a meaningfully lower risk of cardiovascular disease, type 2 diabetes, and cognitive decline. The operative word, however, is correctly. Walking done poorly or infrequently delivers far fewer of these rewards. That is where many people unknowingly go wrong. Let us look at the first mistake. Mistake number 1, starting too fast. Step outside and immediately march at maximum pace, and it feels efficient. But the body pays a quiet price. Muscles are still tight. Joint fluid has not yet been distributed through movement. The cardiovascular system is asked to jump from rest to high demand in an instant. The result over time is a higher chance of muscle strain, joint discomfort, and premature fatigue during the walk itself. A better approach is to reserve the first 3 to 5 minutes for a genuinely slow and unhurried pace. Think of it as greeting your body before asking it to perform. Once warmth builds in the muscles and breathing settles into a rhythm, ease into your target speed naturally. Mistake number 2, poor walking posture. Take a look at the average person on a sidewalk. Shoulders caved inward, head drifted forward, eyes aimed at the ground. This is perhaps the most recognizable walking mistake, and its consequences run deeper than appearance. When the head angles forward, the neck and upper back must exert tremendous additional force just to keep it from falling further. Chronic tension and pain follow. The collapsed chest position simultaneously squeezes the lungs, reducing their capacity to expand. Less oxygen enters the bloodstream, and less oxygen means less energy with every step you take. The solution is surprisingly simple. When walking, picture a fine thread attached to the crown of your skull, drawing it gently skyward. Relax the shoulders and allow them to settle slightly back into their natural position. Let the arms move freely. Direct your gaze toward the horizon rather than the pavement below. This posture allows your lungs to expand fully and helps the entire body move with far greater efficiency. Mistake number 3, using the wrong shoes. Shoes are rarely the first thing people examine when their knees or hips start aching during a walk, but they absolutely should be. As the years accumulate, the body's natural joint cushioning becomes thinner and less forgiving. Old and worn-down shoes accelerate that problem, placing unnecessary pressure on the knees, hips, and lower back with each footfall. A quality walking shoe delivers 3 non-negotiable features: meaningful cushioning to absorb ground impact, firm arch support to hold the foot in proper alignment, and a sole flexible enough to permit natural rolling movement. Inspect your shoes regularly and replace them before they become structurally compromised, not after. Mistake number 4, walking too little during the week. Many people subscribe to a big walk, once in a while philosophy, reasoning that a lengthy weekend outing compensates for several days of stillness. The body, however, does not operate on that logic. It responds to patterns, not one-time events. Infrequent walking delivers only weak signals to the muscles, heart, and metabolism. The body never fully adapts because it never receives a clear and consistent message that movement is expected in. Instead of one long walk per week, it is far more beneficial to walk for shorter periods more frequently. Even 20 to 30 minutes on most days of the week outperforms a single lengthy walk taken occasionally. Consistency is what truly drives long-term health improvement. Mistake number 5, not using your arms. Arms dangling motionless at the sides during a walk may look natural, but it actually represents a missed opportunity. Natural arm swing serves two important roles. It balances the alternating movement of the legs, and it recruits the upper body into the activity. More muscles engaged means improved circulation, greater energy use, and better overall rhythm throughout the walk. No exaggerated pumping is necessary. Simply allow the arms to move in their natural arc with a gentle bend at the elbow. Let the swing match the pace of your stride. This minor shift makes the entire body work as a coordinated unit rather than just the lower half. Mistake number 6, walking while looking at your phone. Smartphones have created a walking hazard that previous generations never faced. Peering downward at a glowing screen during a walk reproduces the exact same forward head and rounded shoulder posture described earlier, only now with the added danger of distraction. When attention is split between the phone and the path ahead, the risk of stumbling or losing balance rises sharply. Beyond safety, the mental benefits of walking, including stress reduction, sensory awareness, and the quiet calm of moving through open air, are completely lost behind a screen. Try keeping your phone in your pocket or bag while walking. Look around you. Pay attention to your breathing and your movement. Walking with full presence is far more restorative and considerably safer. Mistake number 7, ignoring recovery. This final mistake is the one most frequently overlooked, and yet physicians mention it most often when speaking with active older adults. Walking may be low impact, but it still places real physiological demands on the body, demands that require adequate recovery. Dehydration quietly undermines muscle function and the body's ability to repair itself after activity. Skipping post-walk stretching allows stiffness to accumulate gradually over weeks and months, and pushing through day after day without an occasional rest disrupts the adaptation process. The body needs to actually grow stronger. Hydrate before, during, and after your walk. Spend a few minutes afterward doing gentle stretches that target the calves, hamstrings, hips, and lower back. Allow the body a true rest day periodically. Movement, water, flexibility work, and rest are not separate concerns. They form one interconnected system working together to support your long-term health. So why does walking still earn such a strong reputation despite all of these potential pitfalls? Because even with these mistakes, it remains one of the safest and most accessible forms of exercise in existence. It demands no membership fees, no specialized equipment, and no particular location. It supports the heart, activates the muscles, protects the brain, and steadies the metabolism all at the same time. The only investment required is consistency and a small degree of awareness. Correct the small errors, and what already seemed like a healthy habit becomes something genuinely transformative. Walking is not about chasing faster times or covering greater distances. It is about building a sustainable, body-friendly habit that quietly compounds its benefits across months and years. Your most powerful health decisions are often your quietest ones, and sometimes a better walk is all the change that is truly needed. This content serves educational purposes exclusively and does not replace professional medical consultation, diagnosis, or treatment recommendations. Now I would love to hear from you. How long do you usually walk each day? 10 minutes, 2 minutes, or 30 minutes or more? Let me know in the comments below. And if you found this helpful, press the like button so more people can discover these important walking tips. Subscribe to Strong Pulse for more clear and science-based health explanations that make everyday health decisions easier. Knowledge is awareness. Awareness is prevention. Stay curious. Stay proactive. I'll see you in the next video.